It's a multi-million-dollar plan hatched out of desperate need. Last fall, Ohio Governor Mike DeWine pledged $2.5 million to help the city of Springfield manage a population boom.
Nearly 20,000 Haitian immigrants converged on the city in the past decade, coming to the United States legally to flee their homeland and fill the city's need for workers. Their arrival put significant strain on city resources, and that's where state funding comes in, going to expand health care, translation services, law enforcement resources, and driver education. That money helping the Haitian migrants as well as the city's longtime residents. 6 months later, we're taking stock of how that money is being spent and what the city still needs. 2 News reporter Kajaza Hawkins is opening up the books and putting Springfield in the spotlight.
Coming into 2025, we're very much focused on access to care.
Adam Groshans, the president and CEO of Springfield Mercy Health, says as their hospital moves forward, they are always shifting to adapt to the ever-changing community.
I would say every year it has its new challenges. From global pandemics to this past year, we faced a lot of transitions with immigration and with the political climate.
That political climate putting Springfield in the spotlight in 2024. The city's surging Haitian migrant population drawing national attention during a presidential debate. But it's something the people in the community already knew. With nearly 20,000 Haitian migrants legally moving to the region in the past decade, local health care was being pushed to the breaking point. So city leaders asked for help, and the state answered.
One thing we can do at the state is move in and help.
Governor Mike DeWine and Congressman Mike Turner notably vowing to help. DeWine funneling millions in to help with driving, translation services, school safety, and health care as top points of concern.
Haitians who came in just added to the population. Challenges that they were seeing in health care, for example, because of a huge influx of population.
City leaders regularly meet with the governor to discuss ways to help. They say those conversations focus on financial support. Local leaders say they still need state and federal funding to reinforce the other revenue streams coming into the city and to fill the gaps for those that still aren't happening.
We continue to provide the services. Reimbursement, I believe, is certainly on its way to catch up with it, but it's not all there yet. A great example of that is the translation services that we are providing aren't necessarily reimbursable.
However, the hospital continues to face challenges due to the population boom. They have not received any reimbursement for translation services, but they are working to be reimbursed for Medicaid. At this point, most of the migrants do have some form of Medicaid, but if they don't have insurance, financial counselors are on hand to get them care while also working to help the hospital avoid a deficit. And in the midst of it all, Mercy Health is expanding, adding a new oncology center and increasing access to patient care for new mothers and babies, all in an effort to move forward and grow their services for the people of Springfield.
I love the community, and I think folks that are here and understand this community love it too, and it's a place to be proud of.
We reached out to driving schools in the area and some of those expanded translation services to see how state funding has impacted them. They did not respond to our request for an interview.